So hopefully this video has answered some of your questions about setting up the cycler, walking through, answering some of the problems. At the end, it'll say end of therapy, and it may have a beep at the end, but it'll only beep one time. A couple things that I do want to go back and say, when you are setting up your cycler, say for example, you know you're going to be busy between 5 and 6 p.m., what you can do is you can set the cycler up in advance. Say for example, you want to set the cycler up about 2 o'clock where you've kind of got some downtime, but you know between 5 and 6 p.m. or 8 p.m., whatever time, you're going to be super busy. You can set it up in advance and it will stay ready to go until you press the go button. So there's nothing wrong with that. At the same time, as if it hits end of therapy and you're connected to the patient, you don't have to be there at that exact moment. The patient can stay connected to the machine and it can say end of therapy for several hours until you can get to the patient to finish up and end your therapy. So when it says end of therapy, you want to tell, the machine will walk you through, and so you're going to hit go, and it's going to tell you exactly what to do. Close all clamps. So you're going to go through your machine. You're going to close your heater clamp. Close your last fill. Close your fill line. And one thing to point out is we only did just a little brief demonstration. So the therapy volume that you have, these bags will be completely empty. If, for example, say the doctor wrote a 12 liter, but you connected 15, there's going to be some fluid left in the bags. So don't let that throw you. Okay? Then you're going to close your clamp to the patient and close your twist clamp. Again, you're getting ready to do a sterile procedure. It's a sterile thing to disconnect, and you're exposing your sterile parts. With dialysis, with peritoneal dialysis, you have 3 sterile parts. Whatever connects to the patient end of the navy blue part of the patient line is sterile. Of the tank off of the transfer set, that's sterile. The patient connector is sterile, and the inside of your mini cap is sterile. So when you're getting ready to do your sterile parts, you want to make sure you put, or expose your sterile parts, you want to make sure you put your sterile procedure in progress on the door. You're going to do your hand hygiene, and the patient's going to wear a mask. You're going to wear a mask. But you don't need to don sterile gloves, because keep in mind, you're going to be touching a clean part. It's the tips that are sterile. Okay? So, you can put your clean gloves on, and just for demonstration's sake, we'll just kind of pretend. Okay? I'll get the mini cap. And so we've closed all the clamps. Clamps closed. Twist clamp is closed. The clamps to all of your bags are closed. And so we're ready to go forward to the next step. We're going to go. It's going to tell you, please wait. While the machine kind of shuts itself down. And it's going to tell you to disconnect yourself. Close all clamps. Before you do that, there are 2 pieces of information that you want to make sure that you get from the machine. You're going to scroll down your initial drain volume. So whatever this number is, your initial drain volume, you're going to have your Epic opened up to the cycler flow sheet, in Epic, and you're going to document the initial drain. So the things that we have highlighted in green are your end of therapy documentation. So your initial drain, you're going to put that in when you take the patient off. So that'll probably be time-wise about 5, 6, even as late as 8 a.m. Initial drain volume. Down button, total UF. So whatever that number is, it gets documented under ultrafiltration ml. It should always be a positive number. If it's a negative number, the machine can tell you exchange by exchange by exchange how much fluid got reabsorbed back into the patient. A one-time negative number probably isn't going to be too alarming depending on other things with the patient, but that's definitely something that you want to point out to the nephrologist if there's a negative number. Two other things to keep in mind that might produce a negative number is if the patient has constipation. So knowing when the patient's last bowel movement was would be an important piece of information. If you have a patient who is constipated, that could block the holes in the patient's tank-off catheter inside their peritoneal membrane and not allow the patient to drain out. And that could produce a negative number. Okay? So just one thing to think about. And then the next thing you want to document is flow, and what it's asking is, did you have any problems? So for example, did you have to answer any alarms, or if there were no problems? Hopefully there are no problems, but under this list you'll have a list of potential issues, and so you just pick the ones that apply. Okay? When you're putting the patient on the machine and you're setting it up, what you document is the dianyl solution is the dextrose. On this pick list, you'll have all 3 different dextroses in the several different sizes. It could be a 2 liter, 2.5 liter, 5 liter, or 6 liter. Okay? If you have to add something to the dianyl or the dialysate, then what you're going to do is the pharmacy will add that, and it could be heparin or it could be an antibiotic. Then the last thing you want to document when you're taking the patient off the machine is, was the effluent appearance, what color was it? It should be clear. Okay? So that's your Epic documentation. And then you hit go, and once you've disconnected, you can turn me off. So then we've got our hand hygiene done, we've got our mask on, we've got our gloves on, the patient has a mask. What you're going to do is open up your mini cat. Make sure your twist clamp is closed. Your patient's line is clamped. Holding it in your fist, you're going to twist, and holding it by the light blue part, you're going to twist the patient connector off, drop it, get your mini cap, and twist it until you have a thin blue line. So you make sure it's on there good and tight. And then you're done. Okay, before you turn me off, you can lift the door, pull your cassette out, close the door, and then turn the machine off. Now this generates a potential question. You get busy. Oh my goodness, I forgot to write the UF down. I forgot to get the initial drain. No worries. Turn the machine back on. It'll beep. It will say, please wait. You hit the down button, hit the down button again, and right there it is. So you just keep hitting the down button until you see. The thing of it is, the machine will keep in memory what the last therapy volume or what the last initial drain and last UF was until you hit go to start a new therapy. So as long as you don't hit go to start a new therapy, you can still retrieve your data. Okay? But it only holds in memory the previous treatment until you start a new treatment. So once you hit go to start, you're starting a new treatment, all that data is lost. Okay? So while I have you here, we're going to go up, and now you have some opportunities to make some adjustments. So say for example, we're going to hit the enter button. So yes, I want to enter the making adjustments menu. Enter. You can adjust the brightness of the screen. If you hit enter, it'll flash. You can make it brighter. You can make it softer, depending on what the patient wants or what you need. And then hit enter to make it stick. You can hit the down button again and it'll adjust the loudness of the alarm. Say for example, the patient is right next to the nurse's station, so it doesn't need to be all that loud. You can hit the down button and it'll lower the tone. But what if your patient is like 10 rooms down away from the nurse's station and you want to make sure that you hear it out in the hall? You can hit the up button and make it as loud as the sirens that go off on Wednesday at noon. Okay? Hit the enter button. That's what I want. Hit the down button again. Auto dim, no. If you want to make the auto dim work, you hit the enter button. You can hit up, it'll say yes. I'm going to go back to no. But if it says yes, after a period of time, the screen will disappear, and the only way you'll know the machine is working is there will be a silent little green dot that just keeps going across the screen. If the machine alarms, it will tell you exactly what is wrong. And then there should be somewhere in the patient's paraphernalia a Baxter troubleshooting book. You go straight to that menu and it'll walk you through how to resolve that alarm. If for whatever reason you can't find that book, you call the 1-800-Baxter number that's located on the machine. It will ask you for the serial number of your cycler, which is in the bold black letters. Getting a screenshot of that. So you'll need to have that piece of information. And whoever is on the other end of the Baxter line will walk you through how to resolve whatever that alarm might be. Okay. Hit the down button again. You can set the clock. If we're in April and November, if we need to do the daylight savings time thing. And then you can set the date if you need to. It does that automatically. The initial drain alarm. Earlier in our presentation, I mentioned about the initial drain that some patients are dry. If you have a patient who has a dry day, you're not going to be, you want to turn your initial drain alarm off. So you would hit enter and hit the down button and then hit enter again, and then that turns the alarm off. What that means is the patient will still automatically go into an initial drain, but if the alarm is off, what you're telling the machine is don't expect anything out because there won't be anything to come out. And it'll only drain for a few minutes initially, and then it'll flip right into fill. On the other side, if you have a patient that has a full abdomen, has a full peritoneal cavity, then if you have a 2.5 liter fill volume was the last thing that went into the patient, you're going to want to know if that patient doesn't get most of that volume out. So at what threshold? If it's a 2 liter, the machine automatically defaults. You don't have to set it to 1800. So it's going to default to that. You can program it. If you have a patient that has a 3 liter fill volume, you're going to expect more than 1800 out of that patient initially. I hope that makes sense. So, you have your initial drain alarm. You can change the comfort control. And what this is it's 36 degrees Celsius. So the machine, the temperature of the fluid going into the patient, you can make it 37 to 35. So that's your range. So say, for example, the patient is saying, I feel too warm when I'm on the cycler. You can enter the menu. It flashes so you can make a change. You can lower it to 35 degrees. Okay? Or you can make it a little warmer, up to 37. So that's your range, 35 to 37. If you have a last manual drain, again, so say you want to put the patient on the machine and you need to drain the patient manually before you put the patient, before they start the therapy, you can program it to do that. This machine does a lot of things. If you have a ultrafiltrate target, the UF target, what that does is if you get less than what you expect out as your total UF, the machine will alarm and tell you. Sometimes it's just as simple as making the patient roll over to their left side. That's going to maybe change the position of the catheter inside their body, so they'll be able to drain more out. Or you may have the patient turn to their right side. It could be that you might need to set the patient up a little bit. If the patient is laying flat, when you move the patient to a semi-Fowler's position, gravity is going to help you and be able to drain more out. And then alarm, no, go back to the beginning, and now you're at press go to start. So that's your making adjustments.